It is time now for Doc Talk. This is a segment every Thursday here on the News at 6 where we take your questions to local doctors to get you some answers. And we're joined now by Dr. Leo Lopez, Medical Director with University Health. Thanks for being here.
Happy to be back.
Okay, so first question we have from a viewer today. It's all about the measles. They're asking, if you had measles as a child, do you still need to get a measles vaccine?
Thank you for the question. So if you definitely had measles as a child and you've got laboratory confirmation that you either did have it or you have immunity against it, then you're protected, don't need another vaccine. But if you have doubts, you don't know for sure, you don't have proof from a laboratory, then you should get vaccinated. Measles is highly contagious and a dangerous virus. And it can be deadly, especially in young children. So getting vaccinated can help protect not just yourself, but the children in the community.
And we have seen some outbreaks in different parts of the country and where vaccination rates have just been dropping off. Is that what's led to that?
Sure. There's been about 121 cases to date this year. And so it's a few different things that are influencing that. Things like travel, but definitely folks that aren't vaccinated are a higher risk for contracting the virus and spreading it to others if they get infected.
Yeah, okay. Next question is about long COVID. COVID is still out there. It is still with us. This person's writing asking, if you have long COVID, will it show up positive on a COVID test?
Yeah, so there's not one test that's going to tell us whether or not someone has long COVID. If we think about long COVID in the following way, someone gets infected with COVID-19, they might develop things like cough, congestion, runny nose. Usually folks get better in a few days or a week, but other folks will have those symptoms that last for weeks. We start thinking about long COVID at that 4-week mark. So if they've got those symptoms that are continuing at around 4 weeks, we start to get suspicious and concerned about long COVID. So if you're worried about this, definitely connect with your doctor to go over things like your history, your exposure, get a good physical exam and evaluation, get a personalized plan just for you.
And there's a lot of study going on through University Health about long COVID because there's a lot of questions about what it is. So that's great to have that resource. I know we've talked about that a lot and interviewed some of your doctors. Okay, next question is about National Minority Health Month. What is that?
Sure. So National Minority Health Month is our opportunity to recognize the importance that we need to take steps to improve the health for racial and ethnic minorities and to eliminate health disparities.
Okay, so is that happening this month?
April is National Minority Health Month,
okay.
And so glad to address the kind of actions that we can take and talk a little bit about some of these concepts like health disparities.
Yeah, and that's a term people hear a lot, but maybe don't exactly know what that means. So what are we talking about in terms of health disparities?
Sure. So health disparities are preventable differences in the burden of disease, injury, violence, and opportunities to achieve optimal health.
Okay. So there's also a factor here, something called social determinants of health. That's probably another term that people have heard, but we're not quite sure what that means.
Definitely. So we start by kind of talking about examples of health disparities. So we know, for example, that Hispanic people are more than twice as likely to be uninsured compared to white people. We know that Black and Hispanic children are over twice as likely to suffer from food insecurity compared to white children. And we know that, for example, life expectancy for Black people is about 6 years shorter than those of white people. And we know that a lot of that is driven by the so-called social determinants of health. Social determinants of health are the conditions where we all live, grow, play, and worship. This means the quality of our education, the safety of our neighborhoods, having access to food and housing, and having financial security.
Okay, so there's a lot that goes into our health that has nothing to do with what we're exposed to, our genes, our physical bodies. There are other factors that influence that.
There certainly are. And so we've all got to recognize that this month we are working to learn these concepts and how we can play a role in eliminating things like health disparities.
Yeah, so if somebody wants to do something about that, make a difference, what would your advice be?
So this is going to take a collective action because this can be really kind of complex and a heavy lift, but together we can take small steps to achieve what we call health equity, or where everyone has an opportunity to achieve their optimal optimal health status. One small example we can take, so as healthcare systems, we want to try and create what we call health literate healthcare systems. We want to anticipate the needs of our patients, and that might mean ensuring that language or interpreter services are available for folks that might not speak English as a first language. So as a patient, if you are coming in to see your doctor, you have the right to request language services in the language that you prefer. You can also ask the doctor to slow down, to repeat themselves, and you can even disagree if the care plan doesn't meet your preferences, your belief systems, your culture, and through that kind of therapeutic relationship, we can take steps to achieve health equity.
Yeah, kind of being your own advocate. That's advice for everybody in those situations. Dr. Lopez, thanks for being here.
Thank you for having me.
I'm sorry we tore you away from Fiesta.
Not at all.
All right, so if you want to send in some more questions to have doctors answer every Thursday here on Doc Talk, scan this QR code. You can ask us anything, any topic. Send it in. We will get those questions to local doctors, and we will be right back.